according to Professor Nonaka, knowledge creation theorist, he defines knowledge as the justified true belief. Justified truths may be captured by the algorithm, but belief may not be captured by algorithm. The belief belongs to human psychology. So therefore, the psychology and algorithm are, in a way, two sides of the same coins. They're really closely linked, but not identical. And algorithm may provide the patterns, but it's not really, capturing the beliefs or emotion, some. So there's the layers. The tacit knowledge has multiple layers, and algorithm may capture, larger portion of the tacit knowledge, but not the entire one. There's certain layers that cannot be captured by algorithm.
Interesting.
Yes.
I agree with you. Tacit knowledge is really at the heart of knowledge creation and knowledge transfer. And that's why knowledge is so difficult to transfer across companies. Hello and greetings. This is Professor Ravi Sarathi at the Tamora McKim School of Business at Northeastern University, and welcome to the International Business Today podcast. My guest today is Professor Kazuhiro Asakawa, an expert on global innovation and R&D management. He's the professor of global innovation management at the Graduate School of Business Administration at Keio University in Japan. He received both master's and PhD degrees from INSEAD Business School in France. His MBA is from the Harvard Business School, and his BA, summa cum laude, is in political economy from Waseda University in Japan. He has also served as the faculty fellow at the Research Institute of the Economy, Trade, and Industry at the Ministry of Economy, Trade, and Industry, METI, in Japan. And he's worked previously in the international division of the Industrial Bank of Japan before starting his academic career. His particular interests are in the pharmaceutical, biotechnology, and healthcare industries. Kaz, I'm delighted to have you as our guest on the International Business Today podcast series. And thank you very much for taking time to come and visit us here in Boston and talk about your specialty of global innovation.
Well, thank you, Ravi, for a great invitation. It's an honor and pleasure to invite it to the IBT podcast series of the Tamora McKim Northeastern University.
Now, global innovation, it's a very broad term. I think it suggests that innovation happens everywhere, in the US, in Europe, in the UK, in Japan, in China, in Asia, in South America, etc. So let's start off, I think, most useful. Let's start off with your view of what constitutes global innovation and how global innovation is changing, the major disruptions that are happening in the world, and how that might affect this idea of conducting global innovation.
Yes, that's a very big and important question. Global innovation, as you suggested, is a very broad concept. But what I mean by global innovation is innovation, whatever it is, like a process innovation, product innovation, technological innovation, business model innovation, frugal innovation, green innovation, whatever, technological innovation, conducted on a global scale, not on a local scale. And particularly my interest is on how the company engage in global innovation, okay? And then how it evolves, well, in the past, mostly in the international context, the global innovation typically done in a central location, home country, parent company, okay? And then diffused to the rest of the world. Increasingly, the innovation was created and utilized in the local context. And then more recently, the locally created innovation is now diffused and applied to the global settings, so-called the local for global innovation. This is a very complex, complicated patterns, right? And also another trend is that it used to be the global innovation was primarily done within the multinational corporations, subsidiaries engage in innovation, right? But recently, it's more open innovation. So the source of innovation is existing outside of the corporations, and the companies tap into the hotbed of innovation located outside of the companies, and then extract, identify the source of innovation, acquire it, and then leverage it. It's almost like an international entrepreneurship argument.
But it's happening both within the company and across companies.
Exactly.
Very good.
Yes.
So clearly, one of the fundamental aspects of global business in general is constant change, constant disruption.
That's right.
So what are some key success factors in global innovation? More specifically, how can multinationals take advantage of the benefits of conducting global innovation?
Yes.
How can they develop good innovation strategy to take advantage of the fact that talent, capital, knowledge, and demand are all diffused across multiple countries, across multiple markets?
Yes. As you summarized, the disruptions, environmental, radical changes is a major variables. But before that, when the world was flat on the transnational world, the knowledge and people and goods and resources, flowing relatively smoothly. So that's why I think it was easy to implement so-called transnational innovation, right? So in those days, the key success factor of the global innovation was how do companies identify the potential source of innovations, identifying and then leveraging it, right? So it's a kind of a dynamic capabilities in a global version, right? Then comes the disruptions, which is the geopolitical tensions and pandemics and technological breakthrough like AI, digitalization, so all kinds of things, right? That complicates the matters, right? So it's not just the dynamic capability that matters. Of course, dynamic capability matters. But on top of that, the companies needs to demonstrate the more sophisticated capabilities to really manage the tensions, frictions, and technological breakthroughs. So this is very, very difficult.
Yeah. So I guess what you're saying is that the current reality of global innovation is quite new. The environment and the context is quite new. So let me ask you, how are the disruptions? You mentioned AI, for example, right? And of course, the growing protectionism and globalization, deglobalization. So how are these disruptions changing the way that multinationals are engaging in global innovation? You got wars going on, geopolitical tensions, power blocks being formed separate from, the former domination, if you will, by Western markets. And of course, post-pandemic, right? So, so how is this all changing the reality of global innovation?
Yes. For example, let's take geopolitical disruptions, for example.
Yeah.
The world was really heavily interconnected, interdependent, and suddenly the geopolitical tension came, right? And then whether the interdependence is interrupted or not, it's not. So let's take example of the global semiconductor industry, which is arguably the most globally integrated, right? Because the key players are concentrated in 5 or 6 nations like US and Taiwan and South Korea, Japan, China, and Netherlands, and these key players are really, playing major roles, and the global semiconductor companies are heavily relying on these key players, right? And globally integrated, global ecosystem. Then the political disruptions like a US-China, like our tech wars, and came in, and whether the global integrations at the innovation level terminated or not. Well, they continues to be connected, but in a different ways. Maybe bifurcation, bipolarizations of technology development and the global supply chain, global value chain, ecosystems are probably divided to some extent. And the knowledge creation is also bifurcated. And then also, I would say the third party, which do not belong to either camps, US-led camps and China-led blocs, will surge and play a new role, like Singapore and UAE and the kind of places. And then also those who are isolated, like the China has limited access to the high tech from the US and the US-led blocs. They have to develop the technologies by themselves. So indigenous technology may come, like the technologies, the power chips and mobile chips and EV related technologies. They're coming. So indigenous technology may surge. So these are new development. So the geopolitical, configuration changes, but innovation continues in different ways.
You brought up AI. And of course, I don't think there's a single executive in a single industry anywhere in the world who's not concerned about and at the same time excited. So of course, AI is going to affect global innovation, just like it's affecting every other industry. So could you reflect a little bit on, from your research and your interaction with companies, how are companies bringing AI and at the same time using AI to more efficiently and perhaps more quickly conduct their global innovation?
Well, AI is revolutionizing the way the company engage in innovation in a way, because it really predicts patterns, which was very, very difficult in the past, pre-AI eras, unless the companies, managers and scientists, engineers are really experienced. Now the AI helps the companies to be identifying all the patterns without having the prior experiences. So AI in the many different contexts of global innovations are proven to be very helpful. For example, product development, like the fragrance and taste and the beverages and the flavors, taste and preferences of the consumer goods. And these are in the trials and errors. It took a lot of resources and times, and AI helps you to identify the best combinations and ingredients and in the local context. In this particular local regions and areas, this flavor is the most appreciated. Thanks to the LLM and algorithms and machine learnings and even the entertainment business and developing the new videos, movies, and cinemas, like things, and analyzing the viewers, data, massive data. These kind of things.
I'm thinking, I read recently about Spotify, about how Spotify has immense amount of knowledge about individual tastes across the world. And they're using all of this knowledge combined with AI to actually create music that is not created by humans, but created by AI. And more of these AI-generated music is being launched on Spotify, to the point that it's almost impossible to discriminate or to tell them apart very easily. And of course, the danger here is that you won't need musicians anymore. You can just continue to generate AI based on patterns, as you point out, right? So the same, I suppose, possibility applies to many industries. But the thing I'm wondering is, patterns are about history. And innovation is often about taking major leaps, what is called radical innovation, right? So off the top of your head, or from your experience, is AI helping companies mostly do incremental innovation, or is it also helping them do radical innovation?
Well, that's a great question. Sometimes AI helps you to improve products in a general sense, but not in the most extreme sense, right? So outliers, are not really, particularly helped by the patterns, because the patterns are based on all the data, algorithms, right? Algorithm doesn't suggest any peculiar, combinations. and the algorithms and the machine learning suggest all the general patterns, right?
Mhm.
The most representing patterns. So the kind of such unexpected combinations of sounds or unexpected combination of ingredients, and that may appeal
Mhm.
the connoisseurs or the lead users of the products.
Mhm.
So therefore, in that respect, AI may not be able to help that much. And so that's why I would say that hunch or kind of gut feelings or intuitions or like a blink, sometimes called blink, right? That seems to be different from like an algorithm. So what we call tacit knowledge. Tacit knowledge is kind of a very classic concept, right? Something which cannot be articulated, right? Codified, quantified, verbalized. Algorithm, the patterns identification may suggest some kind of the best combination of ingredients or sounds and tones and colors that may appeal to consumers. But in a way, that's a kind of a craftsmanship, very similar to craftsmanship. But it's not really the same as tacit knowledge, because tacit, according to Professor Nonaka, knowledge creation theorist, he defines knowledge as the justified true belief. Justified truths may be captured by the algorithm, but belief may not be captured by algorithm. The belief belongs to human psychology. So therefore, the psychology and algorithm are, in a way, two sides of the same coins. They're really closely linked, but not identical. And algorithm may provide the patterns, but it's not really, capturing the beliefs or emotion, some. So there's the layers. The tacit knowledge has multiple layers, and algorithm may capture, larger portion of the tacit knowledge, but not the entire one. There are certain layers that cannot be captured by algorithm.
Interesting.
Yes.
I agree with you. Tacit knowledge is really at the heart of knowledge creation and knowledge transfer. And that's why knowledge is so difficult to transfer across companies, because it's the people in the company that have the tacit knowledge in their heads, and they communicate with one another, and that's how tacit knowledge gets passed. So I think your point is very interesting. It remains to be seen, I suppose, empirically, whether tacit knowledge in its full capability can be passed on through AI. But there's also the possibility that as different countries and different cultures approach AI development, that they might become more and more adept at capturing this tacit knowledge, right?
Right.
Okay, let's talk about industries now. And as I mentioned in the introduction, from my conversations and getting to know you and your work better, you specialize in the broad healthcare area. Healthcare, pharmaceutical, drug development, biotechnology, healthcare delivery. So how is AI changing these areas, specifically in the healthcare, broadly defined?
Okay. Yes. In the context of the healthcare industries, and also drug development and the therapeutics and diagnostics and operations, these segments of the healthcare industries are all heavily affected by AI because like development, rapid drug and vaccine development are aided by the algorithm and AI, right? By all the pharmaceutical company, Pfizer, BioNTech, and Moderna on this, right? And also therapeutics, really aided by the AI because of the digital medicines and accurate, treatment and the predictable, predictive analytics and predictive medicines and all that kind of things, right? You pinpoint, you link the particular disease with particular combination genes and the drug types, and so predictive medicines helps you improve the therapy part, right? And also diagnostics, right? Diagnostic. Well, AI provides very high quality tools for accurate diagnostics, like all the Googles and Microsoft and all the IBM, Watsons, and these companies are all doing this side, helping detecting the illness, like dermatologies and ophthalmologies and that kind of things, right?
I was thinking of a company I heard about from Singapore, Iris, EYRIS. And what Iris does, I believe, is they've done retinal scans of people because sometimes diabetes leads to blindness.
That's right.
And there are some marks in the retina that can tell you if diabetes is going to cause blindness.
Exactly.
And so they're using these retinal scans with AI to teach the AI to detect whether there is a danger of blindness in the future. And two things are happening. One is much faster, and two, it's as accurate as humans. Right? But what I've understood is to get this approved by not just in Singapore, but the neighboring countries and by the European Union, by Saudi Arabia, in Brazil, etc., they need to have the sample of retinal scans come from multi-ethnic groups, right? So I imagine that, the same thing will happen with many other applications of AI in healthcare, that firms will have to change internally to start thinking about how to not just make the breakthrough, but how to develop it. Because there's a whole range from idea to innovation to commercialization, right? Exactly. So I think, you may have some interesting thoughts about how are firms as well as countries transforming themselves from, sort of domestic to global, closed to open. And maybe since you're from Japan and you have vast experience working in Japan with Japanese companies, tell me a little bit about how do you see the Japanese experience illuminating the broad idea of organizational change as a complement to successfully doing AI-based innovation?
Yes. Well, everybody agrees rationally and logically that AI is a great help. But implementation is another story because, understanding is one thing, but accepting and implementing is then another. So I would say that, diagnostics, therapeutics, and all kinds of things, AI is a great help, but a lot of people still believes that human diagnosis is superior, and also the operation-wise, the hospital operations, the AI helps you identify the patient flows and to make the operations of the hospital much more efficient. But still, there's a resistance to change because, they understand that's the way it is. And the medical people and healthcare people do not really like the word business or making profits.
At least in Japan, that would be true.
Well, yes. So that's why they don't want to talk about too much explicitly about making profit, cutting cost, and they prefer the way it is. And so there's a huge gap, resistance, and kind of between what we understand and what we really want to do. So it's organizational resistance. So this is a kind of a culture to take risks and culture to try to make things better in different ways. And it's a kind of a culture, culture of making change is very, very important.
Now, would you, from, again, your cultural, growing up Japanese and then living in Europe and in the US, would you say that Japan is more conservative and maybe has a harder time accepting change? Or is it just, this is such a different way of looking at healthcare using AI that conservatism would be inherent in all medical applications, whether it's in the US or elsewhere?
Well, I did this, famous index of cultural index, like Hofstede, like uncertainty avoidance. And measure Japan is very high, right? Japan avoids uncertainties.
Risk avoidance.
Right. And also, low tolerance to failures. And so that's the data sharing by introducing the digital technologies to the hospitals and data sharing of the patients that improves the operations efficiencies tremendously, right? that costs a lot of cost, which is a major issue. But still, the people are afraid of leaking the personal informations and patient informations, and so digitalization of patient is very, very difficult. So that seems to be the. I'm not sure if it's just Japan, or it could be very similar, more or less, in many
We do have
societies,
HIPAA,
right?
as you know. HIPAA, HIPAA, is a U.S. regulation that governs private individual healthcare data, and so I'm sure that there are similar constraints on the ability to do sharing of patient records, medical records across hospitals and across the entire caregiving ecosystem. But let me ask you something else. Japan is one of the oldest populations in the world, and the US is also aging rapidly. So is Europe, so is Brazil. China is also aging rapidly. So there's a very broad problem facing healthcare all over the world. How to deal with an aging population, how to deliver healthcare effectively and at a reasonable cost.
Yes.
So what are your insights from the fact that Japan is probably one of the most advanced countries in terms of coming up with healthcare delivery and providing good outcomes for an aging population?
Yes. Like US, Japan has a very high health expenditures per GDP, right? Probably, less than US, but still very high among OECD nations, like 11%, 12%, maybe 11% right now. It's very high, and mostly the drug expenditure is very high. Drug, right? And that needs to be cut, right? Drug, and also the public expenditure because of the national, it's universal.
It's a single payer system.
Right? Yes, so that's why universal healthcare. So therefore, all the public expenditure is very, very huge. And also another problem is that younger generation is supporting the senior generation, so workforce. Workforce generation is shrinking. The senior generation is not shrinking, right? So that's why the smaller portion of the workforce, younger generations, are supporting the senior. And who are users? Senior generations getting sick, and they're using all the medical and healthcare services, and junior workforce generations are still good and healthy, and they're not using that much, right? The healthcare industry, the payers and users of healthcare are different, right? So it's a very unique industry. So that's the problem. So I would say Japan needs to do several things. One is to try to rebalance the portion of the younger generations, senior generation, in terms of the the paying the comparable portion of the expenses.
I get it. You're saying that you need to increase the share of payments into the healthcare system by the old aging generation.
Yes.
Okay.
Yeah. And then this is one thing, this is the huge problem. And the second issue is the digitalization, right? As I referred to a little bit, Japan stays behind the rest of the advanced economy. Japan's healthcare used to be very efficient in compared to maybe the other like a US and. But then now that the digitalizations in the U.S. and are adopting the digital technologies much more aggressively, and then getting more efficient than Japan's healthcare organizations remains largely inefficient because that incurs a lot of cost. So digitalizations, AI needs to be introduced, right, to improve efficiency, and then also Japan needs to accelerate this. Value-based, healthcare. It's again everywhere, right? But it's a lot of elderly, senior patients coming to hospitals and getting prescriptions, and all the drugs are prescribed, and but no results. So you need to emphasize more on the results, outcome. So outcome-based healthcare needs to be incorporated, emphasized. And also the generic drug used to be underdeveloped. Now, really low diffusion rate of generic medicines. Now it's getting better, about 70%, 80% of the diffusions, even in Japan. But still, it needs to be accelerated in order to cut down the cost of the drugs. And so these are among many other issues that needs to be dealt with.
No, I agree with you, because the U.S. is spending close to 20% of its GDP on healthcare. I don't know what the percentage is in Japan, but I imagine it's
10, 11%.
Europe is around there. So you might say, compared to Europe and Japan, the US is spending almost twice as much. So we could learn from some of your examples and European examples. Now, one thing I've been impressed by is the whole robotics industry in Japan, and particularly how Japan has been using robots to help with the aging population. My understanding is many of the seniors in Japan, both women and men, live by themselves, and they need to be watched to prevent falls or to make sure they're taking their medicine, and simply companionship. So to the extent that you're aware of these developments, is Japan at the forefront of using robots to help cope with providing better healthcare for the aged population?
Well, in terms of technology, yes. The very advanced technologies and robotics, right? In an implementation of healthcare, it depends. It varies by facilities. So the challenge is how to diffuse the robotic technologies in the senior, nursing,
senior care,
senior cares throughout the nations. I would say that it's not really as widely diffused as expected. Technology is great, but not implemented. See, and then that's the reason. Another reason why the cultural transformation is necessary. Robotics is a very, very advanced technology, but the senior people may not particularly trust.
Are you saying it's the user perspective as much as the provider perspective? That both sides need to change in order to accept robots as part of the healthcare delivery team?
Yes.
Good. So, reflecting on what you've been saying, what are some of the implications of your insights for policymakers and for practitioners? What would you say to the audience of managers and government officials, policymakers, and in healthcare think tanks? What would you tell them are some things to focus on, to prioritize?
Well, I would say that the healthcare is a very complex industry with the multiple stakeholders, right? So, improving one part of one segment of the industry doesn't help that much. It's the whole industry needs to transform itself, right? So I call for the co-evolutionary progress, right? So so both the providers and the users and decision makers needs to align themselves to implement, heading towards the same direction. I think that's very important. And also the firm level improvement is also important. Advanced drug development is also important for Japan because of the entrepreneurial environment is not really well developed compared to US, right? So biotech venture needs to be much more successful in Japan. And the public sector needs to support the entrepreneurship attempt. And also pharmaceutical R&D needs to be improved, okay? And hospital needs to be much more efficient, okay? And drug policy needs to be improved, okay? It's a kind of healthcare economics policy needs to be. So the government policies, pharmaceutical companies and biotech ventures, universities and patients and hospital organized managers and communities needs to work together to improve. And another point I'd like to make is that because of the disruptions, I think the disruptions helps you to adapt the new technologies. Because of the disruptions, I think you're forced to adapt the new.
You're forced to adapt. Good point. Yeah.
Mm-hmm.
And is Japan doing that? Is Japan, because it's forced to adapt, Japanese companies and the policymakers and even the patients are adapting?
It remains to be seen. Yeah, it's a kind of wishful thinking. I think they're making efforts, but a lot more to be done.
Yeah. I agree with you. I think the ecosystem is what matters. And looking at parts of the ecosystem may make that part better, but it's still constrained by the weaker links in the ecosystem. So very useful. I agree also that this is a very complex area, and it's probably one of the great priorities for the globe. And so global innovation happening in the healthcare field would bring enormous benefits, not just for the country where the innovation takes place, but I think for the globe as a whole. And the companies that are at the forefront of such innovation will benefit enormously because their market will be much broader than if they only thought about it at the home country.
Exactly. The frugal innovation is a big issue. And for those who are in the emerging economies, they're benefiting a lot because of the technological development, like telemedicines and digital healthcares and all kind of technological development allows those part of the world to enjoy the all the treatment, medical and healthcare treatment, thanks to the technological breakthrough.
Great. Well, I want to thank you, Professor Asakawa. This has been a very interesting and wide-ranging conversation. I especially think it's useful to know more about how Japan is approaching healthcare and what, cross fertilization of ideas from one country to the other. I imagine that our listeners, our audience, will have much to think about here and to consider implementing changes in the manner in which they approach innovation, not just in healthcare, but broadly across many industries. And as you point out, the organization needs to change. Certainly, AI can bring some benefits, but it needs the combination of organizational change and collaborative open innovation in order to be successful, whether it's in healthcare or in other fields. So again, thank you very much. And to our audience, if you have enjoyed this episode, please do send us your thoughts and comments. And please do subscribe to our International Business Today podcast series. We have now released about 40 episodes, and we're recording and releasing new episodes regularly. So I hope you'll continue to follow us. And this is Professor Ravi Sarathi at the Demorma Kim School of Business at Northeastern University. And my guest has been Professor Kazuhiro Asakawa. And we both thank you all for listening to us. See you again soon on another podcast.